Hello, I'm Dr. Lizzy Smyth and I am the Chief Investigator for the DECIPHER study. This video should be watched alongside reading the patient information sheet, which contains more detailed information on the study. And you should also talk to your healthcare professional about taking part. It's important to remember that you don't need to take part in the study. And if you do decide to participate, you can always change your mind and stop the trial at any time you would like. You have been asked to take part in DECIPHER because you've been diagnosed with gastro-oesophageal adenocarcinoma, and tests show that your tumour is HER2 positive and ctDNA positive. HER2 is a protein that can be found on the surface of some cancer cells, and these cancer cells can have too many copies of this protein. The extra HER2 protein encourages the cancer cells to divide and grow. ctDNA is DNA from your tumour that was found in your blood after surgery. You will already have been treated with FLOT chemotherapy and surgery. You would usually then be treated with FLOT chemotherapy again. However, studies have shown that patients who are ctDNA positive after surgery, that it is more likely that their cancer will return in future. For this group of patients, we would like to explore whether new treatments might reduce the risk of cancer recurrence. If you take part in DECIPHER, you will be treated with a drug called trastuzumab deruxtecan rather than FLOT chemotherapy. Trastuzumab deruxtecan is licensed to treat breast cancer in the UK and also licensed to treat advanced HER2 positive esophageal cancer. The trastuzumab part of the drug attaches to HER2 cells and activates your own immune system to kill the cancer cell. The deruxtecan part of the drug kills cancer cells when they attempt to divide and grow. It is chemotherapy. It is hoped that this dual approach will shrink any tumour cells that may remain in your body after surgery. If you do consent to participate in the DECIPHER trial, you will first undergo some tests to ensure that the trial is right for you. If you are eligible, you will receive trastuzumab deruxtecan by intravenous drip once every 21 days for a maximum of 8 doses. The administration of the drug takes less than an hour, and you won't need to stay in hospital overnight. Before each administration, you will have some blood tests and a clinic visit to monitor your health and check you can continue receiving the drug. Following treatment, we would like to continue following you up every 12 weeks for up to 24 months. If your cancer shows signs of recurrence, you will return to standard care. During the trial, we will ask you to provide some tissue samples from your surgical specimen, blood and tumour biopsies that will be sent to the Natera laboratory and to the University of Oxford. These samples will be stored anonymously and no one will be able to identify you. The blood samples will be used to see how your tumour is responding to the treatment. We will also ask for an optional tumour biopsy at the end of the trial if your cancer recurs. This will be used to see if there are any characteristics of your tumour that made it less likely to respond to the treatment. We will also ask you to complete some questionnaires throughout the trial to see how the drug trastuzumab deruxtecan impacts on your quality of life. However, it's expected that this will be similar to any course of chemotherapy. Thank you for listening, and please do ask your healthcare professional if you have any questions.